to do a lot of work in tobacco control and non-communicable diseases in India. And they wanted to hire lawyers because even though tobacco is a legal product, it needs regulation. I am Priyanka Dahiya. I've been now working for 15 years. I am a lawyer by training and qualification, and I've been working in public health policy and human rights all this while. I did my law from Nalsar, which is Hyderabad International Law School, and I think I was very clear even when I was in National Law School that I want to work, for the community in the social sector. I hadn't really decided what kind of field I want to choose, whether it's going to be public health. I was too young, and there were very limited guidance available because a lot of students were going for corporate law and litigation. Very honestly, how I got into public health is an opportunity which my law school provided me. There was this organization, Public Health Foundation of India, and they had just gotten a big grant from the Bloomberg Foundation to do a lot of work in tobacco control and non-communicable diseases in India. And they wanted to hire lawyers because even though tobacco is a legal product, it needs regulation. And tobacco also has the first international public health law which covers tobacco control, which is developed under the WHO, the World Health Organization. So that's how they came to my law school. They were looking to hire young lawyers. I appeared for the interview. I got hired. I still wasn't very sure that I wanted to do tobacco control because obviously it was much younger. I didn't understand why would anybody want to work in tobacco, but I think that was a great decision I made. I learned a lot. I was part of international negotiations from, first year of my job. I worked with different stakeholders, whether it was government, NGOs, UN, grassroots organizations, even international experts. And that's what I did for 3 years because I always wanted to have work experience before I go into my master's. Public health is a science, where we want to protect and prevent. Disease is already happening. We want to improve the health of the whole population. It is not a doctor-patient relationship when you're looking at one patient at a time. Of course, a doctor is also looking at thousands of patients, but every patient may have a different problem. The recent biggest example of public health issue and problems was COVID-19. It was affecting everyone.
Right.
And that's when the countries developed vaccines because we want to prevent and protect the community, the society. And for that, there are several steps. You promote healthy lifestyles, you develop laws to prevent, to regulate certain products, to prevent certain infections, to promote collaboration between countries. And the most important is to respond to infectious diseases as soon as you can. And COVID again is one example. So when it comes to policy, public health, sounds just one field, but there is so much more to it.
Right.
And it's a step-by-step process. So, if I give you an example of tobacco control, how we do it. First, you have to identify what the problem is. Tobacco is killing a lot of people, which was, recognized in 1965, I think, by US Surgeon General. That it's causing a lot of deaths and diseases, but they're non-communicable and the effect is not immediate. So, people don't register it. Slowly and gradually, countries decided that, okay, you can't ban the product because banning is always a terrible idea because then there's always illicit products and smuggling. So the best is to regulate it, but you have to do it slowly. So, we as public health policy experts, we decided to target different areas of tobacco. So the scientists are doing research to show how prevalent tobacco is in all age groups, why it's prevalent, and how it's harming different age groups. They bring the research to policy people. And based on that research, we give recommendations, and those recommendations can be to any stakeholder. But of course, if you want a policy at a national level, it has to be given to the government. And then you develop those policy recommendations and share them with the government. It's not that simple that, you just send them a letter and then they accept it and the policy is made. There are so many steps. You do advocacy, you do stakeholder meetings, you do roundtable meetings, because you have to make that, issue important. And I'm giving you tobacco example because tobacco also brings a lot of revenue to the government because it's a legal product. And, cigarettes, I think, are the most expensive product. Gutka and bidi is still very, very cheap, but cigarettes are expensive. So you have to convince the government that what is the burden of diseases because of tobacco on public health vis-a-vis the revenue you're gaining. So that's how policy is made. And, the Cigarettes and Other Tobacco Products Act, which is a 2003 act, and then you have rules, how you have to implement. So you do your research. Based on the research, you come up with policy recommendations, you disseminate those recommendations through advocacy. Then you also have to see if it's getting implemented. It has to be a full circle. We sometimes often see so many laws which are not implemented very properly. And again, once you have a tobacco national law and enforcement officer is a police officer, a police officer's priority can't be stopping someone not to smoke for 200 rupees fine. So, you have to do those trainings to help them understand. They are the enforcement officers, but they have to enforce thousands of laws. And it's not just the police officer. For tobacco, of course, any manager of a public place becomes an enforcement officer. So we had to train them. We had to even train the journalist how to start doing reporting for tobacco control. So, policy is not just what the law is. It's a lot of other things.